posterior myofascial continuity of the upper extremity, especially the abductor digiti minimi, opponens digiti minimi, and the flexor digiti minimi. These forms the hypothenar muscle. So there is a link between the extensor carpi ulnaris tendon. So this is the extensor carpi ulnaris tendon, which has a myofascial expansion or the myofascial link to the hypothenar muscle, especially to the abductor digiti minimi, which is one of the hypothenar muscles. So here a traction here at the extensor carpi ulnaris tendon puts a stress or restriction at the extensor or abductor digiti minimi, shows that there is a myofascial continuum here. So look at that, extensor carpi ulnaris tendon is stretched. By a stretch of this can cause a traction at the abductor digiti minima, especially the hypothenar area, which shows that there is a continuum between the forearm and the hand. So these are the extensor muscles of the forearm. So that's the brachioradialis and the extensor carpi radialis longus and brevis, extensor digitorum, and there is a strong link between the muscles of the forearm, whatever we have seen before, with the antebrachial fascia. If you see that extensor carpi ulnaris, there is a strong link between the extensor carpi ulnaris muscle with the antebrachial fascia. So there is a myofascial linkage between these. So this is the triceps muscles, the long head of triceps muscle, and then that's the lateral head of the triceps muscle. The long head has attachment to the inferior glenoid rim of the scapula. That's the lateral head. So if we reflect it, we can see the lateral head of the triceps easily, and below that we have the medial head. So that's the lateral head, and that's the medial head of the triceps, which also has strong attachments to the brachial fascia posteriorly. So if you see that there is a, as we have seen anteriorly, there is a strong link between the brachial and the antebrachial fascia anteriorly. Likewise, we have a strong link between the antebrachial and the brachial fascia posteriorly. So for example, a traction given at the antebrachial or brachial fascia, you can feel the traction where the line of force is distributed to the antebrachial fascia. So that this indicates that there is a strong myofascial link between the brachial and the antebrachial fascia and forms a continuum between the arm and the forearm. Now going to the trunk, where anteriorly, if you see, the pectorals has attachment to the anterior part of the brachial fascia, as well as pectoral, especially the sternocostal fibers, has attachment to the intermuscular septum of the brachial fascia. Whereas here, posteriorly, latissimus has a continuity with the posterior part of the brachial fascia, as we are seeing in this picture. So that's the latissimus epimysial fascia, which has a direct link to the posterior part of the brachial fascia of the arm. Not only that, it also has attachment to the medial intermuscular septum as pectoral, especially the sternocostal pectoral fiber, how it has attached to the medial intermuscular septum. In a similar way, latissimus also has attachment to the medial intermuscular septum, whereas the clavicular fibers has attachment to the anterior part of the brachial fascia, whereas the latissimus dorsi has attachment to the posterior part of the brachial fascia. Thus forms a myofascial continuum of the upper quarter region, linking the trunk with the upper limb. The infraspinatus fascia, which is considered as the aponeurotic fascia, because it offers attachment to a lot of muscles from the shoulder region and the arm region. So this infraspinatus fascia, which envelops the infraspinatus muscle, it is attached with the upper fibers of trapezius fascia and has attachment with the deltoid fascia. So this upper trapezius and the deltoid forms a upper trapezio-deltoid complex. These two muscles, this complex has attachment to the infraspinatus fascia, and also rhomboids has attachment. The fascia of the rhomboids has attachment to the infraspinatus fascia. So this lot of muscles are attached to the infraspinatus fascia. Thus it is considered as aponeurotic fascia. Perceives and distributes tension created by these muscles acting on the scapula. thus regulating the scapular movement. Posterior myofascial continuum is formed, as we have seen, from distal to proximal. You have a hypothenar muscle which is linked to the extensor carpi ulnaris, which has a strong association with the antebrachial fascia. And you have seen a strong link between the antebrachial fascia with the brachial fascia posteriorly as well. And also the latissimus has connection to the posterior surface of the brachial fascia as well as the medial intermuscular septum, which is nothing but the reinforced brachial fascia. And then the infraspinatus has a strong link, which is the aponeurotic fascia, has a strong link to these trapezio-deltoid complex and as well as the rhomboids, and then it has attachment to the posterior part of the brachial fascia, thus forming a posterior myofascial continuum of the upper quarter region.